Testing. All right, everyone, what I want to show you here is how to, when you click on the lab section and it takes you to Connect, what this allows you to access is not only your weekly quizzes, quiz 1, 2, 3, and 4, but also the APR. So the APR is that cadaver dissection tool, and APR stands for Anatomy and Physiology Revealed. Okay, so when you click on this tool for the APR, Anatomy and Physiology Revealed, this opens up, right? It looks like you can see the dissection of some of the muscles and the bones. And then up here in the top left, you can see it says Select Module. So for week 1, it tells you to do body orientation, cells, and chemistry. So when you click on body orientation, you can then select the topic and you say, okay, I'm going to go through all these topics, obviously, but we can start with, okay, body position. All right, here's anatomical position, here's prone, here's supine. Okay, let's move along. Let's look at planes and sections. Here's the coronal plane, right? Here is the oblique, sagittal, transverse. Okay, when you're ready to look at the, after you go through everything and you want to do cells and chemistry, same thing, you can select the topic, look at the drop down. If you look at the generalized cell, you can, again, click on the different organelles and they'll highlight off to the right as you start clicking on them. Okay, so that's how the APR works. After you would do these and after reviewing the lecture portion, especially the 2 atlases, A and B, you'd be ready to take your first exam. So when we click on the textbook, and see if we can get to the main. It'll take a second for it to load. It usually does. So, okay, here's the ebook. You go to the table of contents here. You go to the index, and you can see, okay, here is Atlas A. Right here's the chapter 1, chapter 2, chapter 3, and chapter 4, which you're responsible for the first exam. But then again, here's your general orientation to human anatomy, right? So if you want to click on body cavities and membranes, that will show up on the lab exam. You'll have to be able to do this. Okay. When you click on cranial and vertebral cavity, right? You're going to see that on the exam as well. You're going to see all of this is fair game. When you click on axial region, okay, not only do you have to know the quadrants and the regions, but all of these landmarks are fair game to show up on the lab exam. Okay, and it's typically drag and drop for the lab exams. Okay, so that's how the lecture book is set up. But this was Atlas A, and remember I said Atlas B is after chapter 10. There's Atlas B. We can look at regional anatomy, tells you a little bit about it. Then you can go to the importance of surface anatomy. And then we can go to B3, which has just about everything there. And I know these also like to pop up on your first lab exam, all these different landmarks here. Greater omentum, urinary bladder, scrotum, right? All these things, femoral vein, femoral artery, femoral nerve, right? So you want to get somewhat familiar with the general anatomy through here. All right, so again, that is how you access the ebook, the APR, and then here's a practice atlas. So the practice atlas is set up in a similar way, and this has a lot of the interactive exercises where you get to drag and drop a lot of the, so if we're doing, let's say, practice body orientation, and you want to do body regions anterior, then these pop up and you get to drag and you say, okay, well, maybe this is the abdominal pelvic area, okay? And if you drag something in the wrong area and you check the answer, it should mark it wrong, right? So let's say we know that's upper limb, and we know this should be lower limb, but we're gonna make this wrong here. We're just gonna put thoracic region here and neck region here, and then we check the answer. Oops, right? And then you get to learn by changing it. So this should help you quite a bit in understanding the anatomy. And again, you can change it, directional terms, okay, which is superior, inferior, proximal, lateral, these, and you look at the arrows, this should really help you. So if we're moving inward, all right, that should be medial. If we're moving downward through the body, we can say that's moving inferior. If we're moving away, we could say that's moving lateral. If we're on a limb moving away, we could say that's distal. If we're on a limb moving up, we're moving proximal. And if it's the body moving up in orientation, it's superior. Did we get it wrong? Did we get it right? Beautiful. I guess I know my stuff. Okay. So that should really help you understand some of those tools in the course and how it's designed to help. These are your practice exercises. This will help also with the APR practice exercises, and then there's the lecture book. Okay, everyone?